Hello. Today we are here with Maranda Miller, and we are interviewing Maranda through this COVID-19 experience in Colorado. And so I'm going to ask Maranda just to share with us who you are, your roots, where you live, and anything else that you'd like to share with us.
Sure. Thank you for having me, Kim, today. My name is Maranda Miller, and I do work for Centennial Mental Health Center. We are a community mental health center that serves the 10 counties of Northeast Colorado. And so we are all rural and frontier counties. Our 10 counties are home to 36 school districts and to very unique communities. While we are very much alike, we're very different as well. I was born and raised in Phillips County, and so my roots are definitely here. I do serve as the Prevention Services Program Manager for Centennial. I oversee a team of 6 that works in the school and in the schools and the community. Part of our work is suicide prevention. Another part of it is mental health wellness. And another part of it is very much centered around the whole person as well. So we definitely spend time on substance abuse prevention as well. I think growing up in Phillips County and that being my roots, my great-grandfather actually homesteaded out in Phillips County, and so there still is the family farm that my uncle and my cousins are currently farming. And so just having those roots and being a part of the community when people reach out and when communities are in need, I definitely have a background with that. And currently I live outside of Sterling in Atwood, Colorado, just outside of Atwood, and have just a few acres with my husband, and my kids do 4-H and show livestock at the county fair like I did growing up. So it's wonderful to be in Northeast Colorado.
Thanks, Maranda. So during this COVID-19 epidemic that has hit our country hard, I just want to start out with current challenges and maybe your experiences. So what has been the most difficult adjustment to your work life due to the COVID-19?
You know, we have moved completely, Kim, to a virtual platform, as many businesses and agencies have done the same. Our work has always been community-based and school-based, as I mentioned before, and both of those locations are not available to us right now for us to be in person with. And as individuals that thrive on relationships and interaction, many of my team are very extroverted. And so this has been a huge adjustment to go virtual. I have been awe-inspired and absolutely amazed at the nimbleness of the team that I oversee and their ability to find ways to connect with schools and with the communities on a virtual level, ways that I would never have imagined. And so certainly all of us are relying heavily on Zoom and other online platforms to still be connected, and really reminding ourselves that yes, we have to be socially distancing, but it doesn't mean that we have to let our relationships suffer because of that. And all of our services are a bit on a standstill in some ways, but yet are being offered virtually in other ways. So what I mean by that is some of our trainings they're all evidence-based that we provide, and many of them are not available virtually. And so that's kind of made it a little bit difficult. We've had some levels of being able to shift that a little bit and offer different variations of trainings, but certainly not to the level that we're used to. Another piece of that too happens to be that when we're looking at meeting people's needs, many of them we have to go back to Maslow's hierarchy of needs and really look at making sure that those basic needs are met before we can even talk about some of the mental health issues that we're seeing and substance use issues that we're seeing. We'd like to get to that point, and I think we are, but we're still worried about people's basic needs being met. And so I think to answer your question is we've all learned that this virtual platform can work, and we all are excited to someday be reunited physically, because there is that need for that for sure in the work that we do.
Great. So you talked a little bit about this, but how would you say that the approach to care has changed during this time? Do you have anything to maybe add to what you've already said?
I can definitely add a little bit. I know that because I do work for an outpatient mental health clinic, and a substance use disorder clinic as well. We do both. We're a behavioral health clinic. That we are, all of those services for the most part, except for psychiatric med appointments, have been moved to telephone and to virtual means. And what we're hearing from our clinicians is that people are actually a little bit more engaged. And I think that's because we're not seeing the need for transportation, because sometimes that's very difficult in our area. And
Yeah.
so people are a little bit easier to connect with, even though we're not connecting with them in the usual modality that our clinicians are used to, and that we do need to go back to, because that is the best way to do therapeutic approaches. It's just at this time, we're actually seeing people be very engaged. And that to me is reassuring. I know also that we have, if people call our Centennial numbers, our phone numbers to any of our offices, they can access our community support line. And that either a clinician or one of our case managers or even somebody from my staff will call that individual back, and they don't have to be a client of ours to receive some support around this really difficult time that we're all going through. So it has been interesting to watch all of those different approaches come around, and that as a mental health center that relies very heavily on Medicaid dollars, that we're still able to operate even though we are not having clients within our buildings.
So what are you most confronted with today?
Oh, today. Well, that's interesting. I think the little bit of the overload of the virtual world that we're in. I know that you and I talked about that a little bit, Kim. This is, I think, my 5th meeting on Zoom today, and I have another one after this. And I do think that it's high fatigue. It's that separation between work and home is struggling. We're struggling a little bit with that. And I've always prided our employees for being very hard workers, but what I'm seeing is that we're working even harder. And I'm hearing that from other industries as well. I have a brother that works for a large farm equipment retailer, and he hasn't moved home as well. And he was saying the same thing, that there's actually a different level of anxiety that we're starting to see with people, or just fatigue in general. Mm-hmm. And so being very mindful of self-care, when I think we naturally do that in our work environments, when we go and chat with our colleagues at the coffee pot, that we maybe go to lunch with them, that maybe we go for a walk during the day, that we're not getting that. We're getting saturation overload from work. And I think we feel also that if we're working from home, that we better be really, really focused all the time. And we're not at the office focused every second of every day. And so I think giving ourselves a little bit of grace right now is probably what I think about the most right now.
That's really great. Thank you for sharing that. Because you're right, it's so important, that self-care, because we work differently when we're at home. We just do. And so I appreciate that so much. So is this event affecting healthcare disparities or social determinants of health? And I know you touched on that, so I'd like to hear more about that.
I really think so. I also think that possibly our kids are being more exposed to higher levels of substance use than maybe they've ever seen in the past, because they may have family members that are struggling with this and self-medicating. So I do think that's a piece of it. Food insecurity is always a big piece of this. We've never had our kids out of school for 5+ months away from the security that school lunches and school breakfasts provide. And that's obviously, like I said earlier, part of Maslow's hierarchy of needs is meeting that physical need of nutrition. And so I am concerned about that. I'm concerned about the trauma and maybe the lack of eyes on our children right now in the homes, that they may not be in the safest environments. And so, and just even the level of anxiety and stress for our kids. I know that when I get on the Google Classrooms and look at what my kids are being tasked with, it's a bit overwhelming because they're seeing their entire week outlined by their teachers, because that's what Google does. And it certainly, I think, makes them very anxious, thinking they have to get done right this minute when they really have all week to get that done. And I know their teachers don't mean to stress them. And I think also we're asking our teachers who are used to having the physical interaction with the children, of being able to hug them and being able to just have eyes on them, not being able to do that is also concerning too. And so, and then just being in an agriculture community, the commodity prices are not good for our egg producers. And I don't see that that's going to improve. And everything that I've been told is it's not going to improve. And so that level of stress is awfully high too. So certainly I know that my team is preparing for the school year to start again in the fall, whatever that might look like, and really doing some trauma-informed care approaches to help our schools and to help our communities, and being really mindful of that everybody's perception and perspective of this is very different. And so sometimes it's easy for us to say, oh, well, it was just prom that they missed, or it was just field day that the kids didn't get. But for our kids, when they have such a small lifespan of understanding the world around them, they don't have much to go off of yet. They've got a really small window of that. It is huge to them. And that does mean a lot to them, that they're missing out on some of these, what we might consider minor things, but are very major to them. Or we're doing some comparative looks at trauma, and we really can't, it looks very different for everyone, and everyone really has to find their own way of advocating for themselves and knowing what is really major to them and what might be minor. Basically, what's in our control and what's not in our control is probably what I'm trying to say. That was a very long answer to that, though.
Oh, thanks, Miranda. So, influence on the future of healthcare. How do you see this changing or altering how you do your work going forward?
I do think that we will continue to use some virtual platforms that obviously were pushed upon us during this time frame that maybe we would not have used in the past, because we do want to offer some we want to offer some level of we want to make sure that healthcare is being offered as equitably as possible in our area. And when I say healthcare, I'm really talking about mental health and substance use prevention, because that's what I oversee and that's what I know the best, is making sure that those programs are provided as equitably as possible. And so when I have over 17,000 square miles that the team needs to travel to provide those services, Zoom, for instance, will become very important to us. And I think a lot of our schools, for instance, will be very open to us providing some of our trainings that we can provide to students over Zoom. And then that really lends to that we'll be able to really interact more with more schools than we historically been able to. Historically, about 24 of our districts have received services every year. And when we have 36 districts that we actually have in our area, I'd like to serve 36 of them. But with the manpower that we have, there's no way to do that unless we cut down on drive time and travel time. And so I think we'll be able to do that in the future.
Mm-hmm. Yeah, I agree. So what do you think that this event, this COVID event, what do you believe, the type of impact will it have on our healthcare system, or maybe already has had on our healthcare system?
Oh, wow. That's a big question, honestly, Kim. I think we're going to definitely need to still be very innovative of the way that we approach things and really open to new ideas. And I think that our contractors, our funders that maybe have really stifled that a little bit for us, I think are going to be more open to it. Because if people are willing to be supported through a virtual modality and it's more cost effective for us to do, then I think that's what we need to be doing, because that feels like the right thing to do. And so certainly that's my hope, and I think that's what we're going to see. And I also think that I know my team, for instance, is really ramping up for offering a lot more training as soon as it's possible. And I think that we're going to have a lot of requests, and so just being prepared for that as well is probably the most pertinent to me right now.
So I'm looking at what from the education side. Okay, so when we look at education, college students, medical students, all those students who are new and they're so excited to get out into the healthcare world. What would you tell future students about this event?
Oh, wow. I would definitely let them know that it definitely was a time, and a major time in our lives, that really did test our resiliency. We talk a lot about being resilient, and we pride ourselves on being resilient, but this definitely tested it. And I think it also let us know that we are intrinsically connected physically, mentally, emotionally, socially, all of those things. And it's so important to understand the whole person. And I hope that that's one of the benefits that we'll have that has come out of this, is looking at the whole person and doing that holistic approach is critical. And we've known that, and we preach it. I think we also preach self-care. I know in every training I offer, I'm like, there's always a few slides on that. Make sure you're doing good self-care. But we got to start walking the walk too. We talk the talk a lot, and it's time to actually put that into action. So I hope that's one of the big things that comes out of this, and that maybe our healthcare providers as well. I'm troubled by some of the recent news that I've seen around our healthcare providers struggling, and a few in our nation have ended their lives during this time of intense stress. And so self-care is very, it's pivotal.
Mm-hmm. Absolutely. So how do you think that this experience will influence you in the future as a trainer and healthcare provider, you personally?
Oh gosh, I think for me, I will definitely take away the, once again, the self-care piece of it. I think that that's something that we'll always need to focus on. I think also really understanding that everybody's reactions are very different during this time. And I've definitely seen that amongst my team and amongst the people that I've interacted with. And so I think offering a little bit of grace to people, I guess, is the best word I can always come up with, that we sometimes jump to conclusions very quickly, or we're quick to think that that's what a person is experiencing, or that that's how they're feeling, or and I think that this time has given me that perspective to take a step back and say, well, that may not be exactly what's going on with that person. That's good trauma-informed care, and we don't always do that. We're just really quick to see the behavior for what, and judge a person on their behavior, when there's so much more to that.
Exactly. That is so true. Just to add to that, I think that this time in our lives, we all respond differently, and maybe someone was on the verge, and this has really just flipped them into a place of real true trauma, because they're beyond able to cope with this event, kicking them into a place of I'm done, I can't do this, and And so it's almost taking that toolkit that you have and making sure that you have every tool replaced with a nice shiny one, ready to go.
Yes.
So how do you feel about how you would use the lessons learned from this event to improve healthcare education?
Oh, wow. That's a really great question. And I'll have to go from the angle of mental health. And I certainly think that when we're looking at mental health care, many times, especially in our rural areas, people wait till it's basically a level 4 crisis situation. And I think that this is a really great time for us to be able to instill that we don't want to get to that level. Let's talk before then. Let's get some efforts going before then. And so I think to answer that, I think that's the biggest piece of it right now is we have the ability, we have the infrastructure to be able to help people a lot sooner. And even from the comfort of their home right now, where they may feel a little bit more willing to tell us more of what's going on. And I know that is something that is a vulnerable thing for people as well. But certainly if they're willing to take that step, and that offers a little bit of anonymity. Nobody sees them parked in front of the mental health center. Nobody sees them walking through our doors. And so, gosh, I hope people will take advantage of that opportunity that's right in front of them right now.
Great, thank you. So Miranda, I know that you are a leader in your role with Centennial Mental Health. And so you have a leadership role that you have to maintain yourself, but you also, there's also that self-care that you've talked about. And so really, what have you been able to do to exercise leadership during this time when you also are impacted just like the rest of us?
Yes, overseeing a team that, like I mentioned earlier, many of them are extroverted, and this definitely rocked their world to not be able to go out into the communities and the schools. And so I definitely spent more time with them virtually, and many times our regular supervision times would be overtaken by meetings and trainings and such. And at this point, we've been able to keep a much more regimented schedule. And I really hope we can continue that, because I think that my team deserves that, and I deserve that with them as well. And so certainly taking that time with them, reminding them that I expect them to do self-care during this time. So if that's putting a load of laundry in between meetings because it makes them feel a little more in control and helps them in the evening, then I want them to do so. And so I'm pretty boisterous to them about maintaining that piece of it. And, and I also demonstrate that myself. I do try to log off as close to 5 as possible on my computer and keep my schedule up to date so that they know that when I'm available and when I'm not available. And having that distinct shutting down time, I think is really important. So no, and then being very flexible what their needs are. I've had some staff that needed to adjust their schedules, and obviously many of them are working from home. And I think I've surprised them a little bit in my level of flexibility, but Centennial's offered that as well, that we need to be flexible during this time. Our staff need that. And so with my team not directly caring for clients and being in that role, they can have some flexibility of moving their schedule around or utilizing some of their talents. I have some that can do awesome videography. I have no idea how to do any of that. And they have come up with some really great ways to connect with our communities and schools through that. And even just doing, a couple of them did a video on creating a meal the other day. And while that might seem outside of what Centennial should be doing because we're mental health and substance abuse prevention work, it is, because that's meeting our nutritional needs, and nutrition is so critical right now for people. So I think just really my leadership style has always been to focus on what people have that they are truly talented in, and helping to cultivate that and then getting out of their way. And I think that that's been my real goal during this time.
Well, I think that you are, you must see my questions, because every question that I have is like, you've already started that, your response. Um, so the next question is, what have you learned about yourself and others?
Oh gosh. Well, what I've learned about myself is that I probably wasn't doing the best self-care,
Mm.
and so that I am a creature of habit, and that probably like many people, I had to mourn leaving my office. I packed up many of my files and um, basically moved my office home. And I remember turning around and looking at my office and thinking, I don't know when I'll be back.
Mm.
And that there's a grief component to that.
Mm.
And so I think that that was something I've learned about myself. And then that I am a mother, and we schedule, and we let our kids do so many extracurricular activities that they absolutely love. But I love watching them learn new skills and to find new loves in their life, and for them to be resilient too. So that's been really awesome to see. And then I think your other part of your question, Kim, was about others. Is
Mhm.
that?
Yeah.
I've been really amazed at um, just some of the thoughtfulness of other people,
Mm.
and my staff included. And obviously I live in a rural area, and so I have a neighbor that just drops off fresh farm eggs every so often on my doorstep and texts me and says there's eggs on your doorstep, and just some of those small things like that. I think that's probably what I've learned the most from others, is that the small things are really truly, I know it's cliche to say, but they really are what really matters.
Yeah. So what has surprised you the most?
Oh gosh. I think what surprised me the most is the ability, especially in my work life, for us to switch gears. I think we spent the first week of this COVID crisis in absolute shock, and we had to undo everything that we had planned for the foreseeable future. And that, I think, was, I'm glad we gave ourselves that time, but boy, did we kick it into high gear after that. And so while I can't be physically with my team, I get to see what they are accomplishing virtually, and it's absolutely phenomenal. So I think that's probably what, it shouldn't have surprised me, but it has. It really has. That we continue to, I mean, it is part of what we say that we do at Centennial. We move lives forward, and we're continuing to do that.
Great, great. So what is the most difficult adjustment to your home life?
I think juggling school, work, and home, in one, under one roof is difficult. And so that's where probably the biggest challenge is that time management piece of it, and helping my kids with time management, because school really offers that. So they keep them on a schedule, and I've had to really think about keeping my kids on a schedule. So that certainly probably has been, although I'm excited about some of the, like I said, the new adventures that we're doing as a family. And one is actually growing a garden. We have never grown a garden, even though we live on a property on several acres and could obviously have a garden. Our summers and our springs have never lent to us having a lot of time to do that. And that's exciting to me. I'm just going to put that out there.
That's so great. I love it. So you're talking about doing something new and different, but what activities have you had to delay or have decided not to do during the current situation?
Yeah, I mean, especially personally, we're used to a lot of sports in our household, and that's not happening, as well as the uncertainty about even our local county fair. We went ahead and bought our livestock for our kids not knowing what will happen for sure, although our fair board is so committed to helping the kids in whatever way they can. But I really thought that was a sense of normalcy to go and pick out the lambs, get them, and raise them just as we normally would. And so that's part of what I've been trying to do, is keep some of that normalcy like that.
Mm-hmm.
And then I would say, work-wise, trying to look to the future. We don't know what date we can start going back to doing some of our usual work, but starting to make some strategic plans around that. And so those are just some of the pieces I think that offer you at least that hope for the future, which we all definitely still have to have.
Mm-hmm. Absolutely. So, what do you do to decompress outside of work?
Yeah, I've been doing a lot more cooking and baking. My waistline is starting to show that a little bit, so we'll have to maybe curb a little bit of that. And then obviously getting outside and spending more time. My daughter has shown more interest in riding horses, and so we were able to, with my in-laws, get her a horse to start riding that is what I would call kid proof, which is awesome. And so watching her have a love of something that I did growing up and that I've never had time for her to do in the past. And so now we finally can do that. And so just spending a lot of time, our evenings, I feel like we get more time together as a family as well. And that's been really, really great. So yeah, I definitely feel that home is actually, we always say home is where you need to be and where your heart is, and it truly is right now. And that's awesome to get to experience that. And I'm anxious to see what my kids say someday about this time period, and I hope that they have actually maybe some good memories about it. I'm sure they'll share some struggles, but definitely some good things that have come out of it.
And so, how do you turn it all off? How do you turn this off? Because it's penetrated every part of our lives, right?
It really has. And I think the biggest luxury I have is that Centennial is very connected to our public health departments. And so I look at their websites, and I look at the Colorado Department of Public Health and Environment's websites for the latest updates, for the latest numbers, things like that, to be educated about what's going on and what precautions we need to take. But I don't watch the evening news. And I really just don't. I think that our news is always usually very negative, and I understand that they have to report what they think is what we need to hear, but I do stick with our vetted state sources on what's going on. That's really how I manage it. And then just knowing that it's okay to be at home and I don't need to go out a lot, so might as well keep my family safe and we just stay home more. And so yeah, that's probably been the biggest thing for me, is not giving into the fear of all of this, because that could raise our anxiety quite quickly. And I do have some people in my life that will do that a little bit, and they'll call me and I'll say, I haven't heard that from a reputable source, so I won't comment on that. But that's been the biggest way to turn it off for me.
Mm-hmm. Sure. So how do you want history to be recorded related to this event?
I hope that they'll record it from many different lenses. I hope that they'll look at it from the medical lens of the tragedy of it, because that's very real. I hope they'll look at it from how we did become more resilient through it, how we did make changes in our society, because the fact of it is that this is a grief process that we're going through right now. And our new normal is not going to be the same normal that we had before this. There will be a lot of conversations around before COVID we did this, before COVID we were able to do that. And so as we did with 9/11, I had those conversations with my kids all the time. Well, before 9/11 we could do this, but we can't now. And it'll be the same. And so I hope that there's some really, that we don't have to have our lives scheduled every minute of every day, and that it's not lazy to stay at home and to just be, that we don't have to have an agenda all the time. I hope that that's recorded.
I love that. So that we just were talking about recording history. And the next question is, how do you think this event should be remembered?
I hope it's remembered really as an unfortunate situation that everyone tried to do their best, that people's intentions were good, and that maybe things didn't turn out exactly how we thought they would, but that people really did want the best for everyone. And I think that sometimes gets missed sometimes. So I hope that that's part of the record of it, is that we learned something from this about our society, about our resiliency, like I keep saying, about that it's okay to be vulnerable, and that offers a very authentic approach to everything that we do if we are truly in line with who we are. And so I hope people have taken some time, and that's recorded as well, that people took some time to find out who they are, because I think we have over the years been lost in just the rat race of life.
Mm-hmm. Sure. Well, super. That is the end of my questions, and I really wanted to give you an opportunity to share any last minute thoughts or anything that you feel is really important for you to be able to memorialize this in this video.
Oh, well, thank you, Kim. I appreciate the opportunity, and I come from a generation that has had very few big historical experiences. 9/11's in there, and many other things that my generation has seen, but certainly not, 9/11 was huge, but this has a really intense magnitude to it. And so I guess I'm just hopeful that people will look back on this and think, gosh, that was tough, but boy, we made it through.
Mm-hmm. Mm-hmm. So I guess I have one last question.
You're fine.
Just as far as your family, mm-hmm. what do you want? What do you think will come out of this that you will do differently with your family going forward?
I think I will be much more intentional, and I won't feel so torn when we make decisions not to participate in certain activities or schedule our lives so intensely. I won't feel that that's hurting my family, because it is reminding me, especially as I'm watching my children right now. The oldest one will be a freshman in high school when he returns to school. And that has hit me. That has really hit me, that we are suddenly going to leap into his last 4 years of school in our household before he leaves to go do other things and other educational endeavors. So that's my big thing is I'm going to be really okay that, and I have, my brothers are spread throughout the United States, and I'm not going to feel guilty about booking those flights. They actually live in places that are very inexpensive to fly to begin with, but I've always kind of had to rationalize and justify it, and no longer. That's off the table.
Awesome. So anything else that you want to share?
Not really. I just want to thank you, Kim, for this opportunity, because we don't. I fear that our generation right now, and where we're at right now, that we won't take the time to memorialize this, and that some of this will get lost. Mm-hmm. So thank you for taking this time.
Yes, thank you so very much.